Good afternoon, everyone. The topic of my presentation is multifocal IOL, many focuses, one surface, trifocal, three focuses, three surfaces. Choose your clarity. There is no financial disclosure. So high definition analyzer, it is an instrument which is based on the double pass technique, which is developed by Visumetrics. The components measured by HD analyzer are objective scattering index, tear film stability, depth of focus, and best focus. The comparison between multifocal and trifocal IOLs will help in assessing the quality and the quantity of vision in the correction of high refractive errors. So this OSI will be useful in comparing the visual outcomes and the diffraction of light in multifocal versus trifocal IOLs. The objective of our study was to compare the optical quality between multifocal and trifocal IOLs to evaluate the stability, efficacy, and safety, analyze the light diffraction patterns, and to determine superior clinical optical performance. So the study was a prospective study, interventional, non-randomized study carried in a tertiary eye care center in Bangalore for a duration of 2 years. 200 eyes were selected, out of which 100 eyes were selected in each group of multifocal and trifocal, with age more than 45 years, undergoing cataract surgery with healthy ocular surface, with Technis multifocal IOL, Zeiss at LISA 809M model IOL in multifocal group, and Optiflex Trio, Acris of IQ Panoptics, Rayner Trifocal, Technis Synergy IOL, Zeiss at LISA 839MP model IOL in trifocal IOL group were selected. The examination included slit lamp biomicroscopy, dilated fundus examination, measurement of uncorrected distance visual acuity and near visual acuity, and objective scattering index, which was done on post-operative day 1 and day 30 in these patients. So the demographic details were comparable in both the groups. When we compare the visual outcomes between trifocal and multifocal group as a whole, the visual acuity were comparable in both the groups, but the OSI was found to be lesser in cases of multifocal IOL than trifocal IOL. But when we compared the individual IOLs in each group, so we found that Zeiss IOL had lesser, Zeiss multifocal IOL had lesser OSI as compared to Technis multifocal IOL in cases of multifocal group. In case of trifocal IOL, we found Zeiss at LISA trifocal IOL had lesser OSI as compared to other IOLs in the trifocal group. So the key parameters which influence the OSI are the pupil diameter, apodization, number of diffractive rings, central clear zone diameter, near addition, light utilization, and distribution. So there are many studies which compared OSI in different types of IOL, but in our study we compared OSI in between multifocal and trifocal IOL, which offers important information on their optical characteristics and potential clinical applications. So in our study, multifocal IOLs have outperformed the trifocal IOL in terms of optical quality. Except intermediate visual acuity, which is better in trifocal IOLs, distance and near visual acuity measurements were comparable in both the groups. The important considerations to be taken in this comparison were the post-op day 1 versus day 30 differences due to the impact of corneal edema, influence of anterior chamber reaction, role of spherical aberration, and light distribution patterns. So we concluded that the superior optical performance of Zeiss intraocular lenses in both the groups, it is due to the neutral spherical aberration and optimal light distribution. So the clinical applications that can be used is the patient selection criteria and the expected visual outcomes can be assessed to manage patient expectations and for proper post-op care considerations. So we conclude that though multifocal and trifocal IOLs have comparable distance and near visual acuity, with intermediate visual acuity being better in trifocal IOL, but OSI clearly states that multifocal is better than trifocal IOL. So IOL designs come in a variety of forms today, each with unique advantages and restrictions. In patients with ocular comorbidities like retinal comorbidities, etc., IOLs which induce lesser scattering index will have better clinical resolution in these patients. Though OSI is mainly an optical phenomena and vision a neural phenomena, so correlating both of these factors will give a better visual outcome. So further more research opportunities that could have been done in this study was long-term follow-up of these patients, the quality of life assessments, impact of different optical designs, role of new measurement technologies, and patient satisfaction correlation should have been considered, which was not taken into account in our study. These are my references. Thank you.
So I wanted to ask, like, at the start of the study, you told you have taken multiple lenses, but
Yes, sir.
in comparison, you have just compared two lenses. So why at the start of the study you took, like, you told in the study there are
So
many lenses.
actually, we did not take into consideration on the number of individual lenses. We just randomly selected 100 IOLs in those 2 years
But you
period in our
compared
institute.
only the two, right?
No, sir. As a group, we have compared all the multifocal and trifocal IOL of those 100 patients. In that 100 patients, the individual lenses also we have compared which were used in our institute.
And in one of the slide you told multifocals are better in optical quality than trifocals.
Yes,
But
sir.
nowadays it's the reverse that we are
Yeah.
using, right?
Yeah.
How will you explain that then?
So because we have compared only one parameter, that is the OSI just, but we didn't compare the other parameters like the patient satisfaction rate and
So how
contrast
will
and
this
aberrations.
study help us? In what regard do you think will it help?
This study will help in making us understand that not only OSI but also other parameters are to be considered depending on the patient requirements.
Okay, thank you.
Thank you,
How
sir.
frequently do you do multifocals vis-a-vis trifocals in your center?
Sir, like in our center for private patients, like mostly multifocal and trifocal have been used
So,
depending on their requirements, because
so
most
like
of them
out of 100 patients, roughly how many multifocals and how many trifocals?
out of 100 around 10 will be multifocal and 10 will be trifocal, sir.
Right, almost equal numbers
Yes,
of
sir.
multifocals and trifocals.
Yes, sir.
Right. Thank you.
Thank you, sir.